How can you have complete confidence that the clinical spaces you're paying millions of dollars for will be efficient, safe, and tailored to your needs? Gresham Smith & Partners has found a way to give their clients that confidence in the earliest stages of project development. Their answer? Mock-up rooms like this one. We're in a warehouse just a short walk away from the new multi-million-dollar Clarian-Arnett Hospital in Lafayette, Indiana. Even before the groundbreaking took place, GS&P designed these mock-up rooms to give hospital administrators and their patient care team the chance to see, experience, and test the rooms. It's another part of GS&P's commitment to incorporate client feedback on the design.
Well, my first impressions were that it wasn't necessary. It sounded like an unnecessary expense.
Dr. Michael Skehan, CEO of Clarian-Arnett Health, says he was a skeptic until he experienced the process himself.
No, I really think it's been a valuable experience for us. I think that the ability to walk through the room, actually feel and touch and get the spatial configurations are really important when it comes to understanding what we're building.
GS&P's mock-up rooms are built in 3 stages, each offering its own lessons. The first stage can be as simple as an outline of the room using tape on the floor. Here, a basic steel frame has been built. It's at this stage that physicians, nurses, and support staff get their first feel for the actual size of the room.
We actually learned from this experience that the room size was very appropriate for the majority of surgeries, but 2 specialties, open heart and neurosurgery, we actually asked that the room size be increased, so we actually moved the wall 2 feet.
It allows you to get to the optimal design on the front end, as opposed to having to make review designs and changes after you've occupied the facility.
The next stage is gypsum board. At this nursing station, the most basic walls, shelves, and countertops have been installed to give the station its true 3-dimensional shape. Clients can evaluate things like the height of the counter, the depth of the cabinets, or the sight lines from workstations. Staff are encouraged to use Post-it notes or to write their thoughts directly onto the gypsum to leave their feedback for GS&P's designers.
It helps us save time, it helps us save money, and then it helps improve quality. And those are the 3 aspects of a great project: are the schedule, the budget, and the quality of the project.
GS&P's unique approach adds a 3rd stage, a fully equipped room, taking the process to the next level. This LDRP gives staff the chance to simulate their everyday tasks because there's no substitute for real experience.
It's been a very positive experience. We've had clinical staff come into the rooms. We've done mock drills such as code blue.
We're able to get down to the final placement of, say, a med gas outlet, and we're able to bring the clinical staff in and say, from a work perspective, a workflow perspective, if you're here, here, and here, does this work for you?
It will put the patient at ease when they walk into our facility to see that the staff moving throughout in an environment that they're familiar with.
Dr. Skehan also says the public relations value of these rooms can be tremendous.
The main thing that medicine is accused of in this country is not being patient-centered. So we have the opportunity to bring in lots of our constituents in the community to look at these mock-up rooms and give us their feedback so they have their stamp of approval on what we're building.
Client feedback at every stage results in improvements to the plan. How important is that? Well, consider that hospitals will have hundreds of repetitive or identical rooms. Changes to the design in the mock-up stage of the project will save thousands, maybe millions of dollars by avoiding hundreds of replicated inefficiencies. This can eliminate frustrating workarounds, enhancing quality of care for the life of the facility. Plus, when staff takes an active role in planning, it creates a sense of ownership in their new hospital. When architecture truly supports the processes and the people of the facility, the value is immeasurable.
To see modern rooms designed like this, it typifies a contemporary delivery of healthcare.
I think it says that Gresham Smith is trying to endorse and promote best practices these days for their healthcare clients, which is to take your designs and thoughts into a mock-up scenario and try to let your customer, the end users, experience the space.
They've listened, they've challenged, and I think together we've made the best product in the best possible healthcare facility for our community that we could have.